Hi everyone, Dr. Brian Steiner here at Wilkins Spinal Care in Mount Pleasant, Pennsylvania. So this week's blog, we are going to talk about treatment plan. So I have here a not so well drawn out pyramid and some schematics. As you can see, I was not an artiste of any kind. But this week we're going to talk about a treatment plan and why we do one here at our office. Not all chiropractors do a treatment plan, but at this office we do want to give a treatment plan because we want to give the patients the health that they want, the health that they deserve. So rather than sitting down showing you exactly what we do, I'm going to actually draw out and explain to patients the pyramid of our treatment plan. So here's our pyramid. We start down at the bottom. As you can see, the bottom is the largest section, and as we go up the pyramid, it gets smaller. So the first stage, stage one, pain phase. This is the phase that everybody comes to our office and they're in pain, they want out of pain, okay? So fun fact real quick, as far as pain's actually the last thing that actually happens with a patient. Whenever we do an exam with a patient, we do x-rays. The rotation we see, the results that come out in the exam, those are things that aren't new. Those things have been going on for a while. The rotation we see in a pelvis or in the neck, vice versa. You know, these are things that have taken weeks, months, and more than likely years. Pain's just, after a while, the body's just like, I can't take anymore, and that's when pain comes into play. So, patient comes into pain. Our job is to get you out of pain. That can take a few days. That could take a few weeks. That can even take a few months. You know, it just depends on the patient and the severity of the patient. Once they're out of pain, whether they're a decompression patient, chiropractic, neuropathy, it doesn't matter. They're all in this category. Once we get them out of pain, we move to this phase, stage two, stabilization phase. This phase right here is the most crucial phase. This is the phase when people start to feel good. They're, man, I'm feeling good, I'm out of pain, I don't need to come anymore. That's the problem that patients have. And that's the problem that actually a lot of other chiropractors do too at other practices. Once they get to this phase, they're like, oh man, my patient's out of pain. I'm going to release them. That's the worst thing for the patient. Because here's the thing with the stabilization phase. Yes, you're out of pain, but your spine is not where it needs to be at. It's still in that position that it was before you got in the pain in the initial visit. So this visit, you know, you don't have to come in quite as much, but we're still seeing you a couple times a week to make sure that spine goes in the position that we want it to be, and not the position that it's been in for so long. So the problem with this, you know, if someone slips or falls and they're not continuing care, guess what happens? They go right back to square one. So we don't want that to happen. Now, someone who's getting care goes into the stabilization phase and stays up with their treatment and their care. When they have that fall, when they have that slip, they're not going to go back into this phase, and if they do, it's going to be very minimal compared to someone who's not getting that stabilization care. So as you can see, I have some wonderful schematics here. This person's crying, he's in pain, he wants out of pain. This patient, he goes from this phase, ow, and all of a sudden now look at him, he's happy, and he has hair, not like me. After this phase is over, this is the last phase that we want patients in. And here's my two little schematics that I have for the maintenance phase in stage 3. I have a picture of teeth, and I have a picture, it looks like a box, someone in a refrigerator box. It is a car, I'm not a drawer. So I want you to think of two different scenarios. Everybody goes to the dentist at least twice a year, or at least they should, to get their dental cleaning. Teeth are important. Without those cleanings, your teeth can rot, they can fall. We don't want that. Same thing with your car. Every 3,000 to 5,000 miles, you need an oil change. Without that oil change, your car can't go. So think of the adjustment as the oil, and your body as the car. You need that adjustment every so often to keep your body maintained. Now, as far as the maintenance phase is concerned, it just depends on patients. Some patients we tell them once a week, some we tell them every other week, some we tell them every 3 weeks, once a month. You know, it just depends on how they first presented to our office when they started in stage 1, and how they presented in stage 2, and then how they're presenting in stage 3. So that is my little schematic for this week. Again, not an artiste of any kind, but I hope this gets the point across and how important a treatment plan is. We provide every patient a treatment plan because we know that it's the key to their restored health, and we know it will get them better. So that's all I have for you today. If you have any questions about anything, please don't hesitate to reach out to me, give me a call. I'll be happy to answer any questions for you. Otherwise, everybody enjoy the nice weather we're having this week, and we'll see you next week in next week's video.